Thumbs up, Morgan. Welcome. This is Prairie Rehab Facebook Live. Today we're going to talk about exercises, and my name is Jeff Steinberger. Remember to like us on Facebook, and I'll let Megan introduce herself.
I'm Megan Johnson. I'm a physical therapist assistant with Prairie Rehab.
And we'd like to congratulate all the graduates. This is in May, and we'd like to congratulate the graduates. And in honor of that, I happen to know that Megan is an NDSU fan. So, as it turns out, the rumors about NDSU are not true. The library did not burn, and both of the coloring books are still intact. So, congratulations to all the other graduates.
Burn. I love all my NDSU peeps out there. Well, today we are going to be talking about how to feel better in 15-ish minutes. I know that a lot of us are feeling the same right now, a little down, a little glum, hard to get up and get moving and get motivated. Some of us are out and about, but a lot are still stuck at home, and it's really easy to get comfy in your chair and get started on a book or a good TV series and not get up and move. And a lot of times that results in it being harder to get motivated to do that. We develop more pain, stiffness, fatigue, and so we are going to be going through just an easy, simple exercise program that you can do sitting right in your chair in your living room while you're watching the television or doing what you do in your living room.
Reading your book.
Reading your book. Well, you can do it while reading a book too, I suppose.
Yeah, right. And again, just a reminder, we've done some of these other exercises. We've had several other Facebook Lives that we've shown other exercises for taking care of your back, taking care of yourself at your workplace. Tim did a great job with that. Outstanding information. We've also talked about
knee exercises. Jason had a wonderful live about preparing for a total knee and just general knee strengthening exercises. So please refer back to those videos. They are posted on our Facebook page. Comment if you have questions on them.
And YouTube.
And YouTube as well, yeah.
And to go to YouTube, you go to YouTube, put in Prairie Rehabilitation / physical therapy. And there are those previous ones on there, and then there's also some additional ones, including manual lymphatic drainage and so forth. So, good information.
And we're always here to answer any questions you have. So please leave comments or get a hold of us where you can. Just going over, talking about joint stiffness and overall fatigue. Lots of research has shown that people with fibromyalgia to arthritis, general joint stiffness in aging or just being sedentary, these people greatly benefit from low impact, easy exercises that you can do in your chair, and just 15 to 20 minutes of exercise helps improve that joint stiffness, the pain, and overall helps improve our mental wellness, just getting up and being active. And so we're just going to go through a couple of those exercises Jeff is going to model for us. So,
and remember, we're also going to do a follow-up on this on Thursday. So we'll do a follow-up, which is more higher level exercises, and on that day Megan gets to be the model, since she talked about arthritis, old age, and all of those stuff. So that's why I'm modeling today, and then she'll be the more fit person on Thursday.
That's what we call it. We're going to start with just some upper body arm stretches and exercises. So the first thing we're going to do is get loosened up in our wrists and shoulders. We're going to do a Flexor and Extensor Stretch. So Jeff, arm out in front of you, and you're going to gently push down and hold that stretch for about 20 to 30 seconds. We want a nice gentle stretch. Don't overstrain. You should never feel pain while you're stretching.
Why am I doing that for 20 to 30 seconds? That seems like a long time.
If we don't hold a tissue stretch for 20 to 30 seconds, we don't make a difference in the actual muscle tissue. the fibers will bounce right back to where they started from. So to make a difference in that muscle tissue, we have to hold it for an extended period to change the actual muscle tissue and extensibility. So now we're doing the opposite of that in an extensor stretch. Same, holding it that 20 to 30 seconds. When you're doing a stretch, you also never want to bounce the stretch. It's a static hold for that entire 20 to 30 seconds. Then you can do, we can do that on both wrists, recommended on both sides. We'll go into some shoulder rolls. Rolling backwards. We try to get away from doing the forward shoulder roll as we are prone to being in this bent over forward position naturally. We want to do anything you can to get those shoulders back, open up the chest wall, and improve your posture.
I crackle and pop when I do that.
Does it cause pain?
No.
Then that's okay. You will have snap, crackle, and pops. As long as it's not causing you pain, you should be okay to do a gentle exercise such as that. I'm going to do that 10 to 15 times.
Off and on throughout the day.
Yeah, off and on throughout the day. And that leads us into our next exercise, which is shoulder blade squeezes. So what Jeff is demonstrating is pulling those shoulder blades down and back. We don't want you lifting up to your ears, as that overactivates these muscles that want to be overused anyway and can lead to neck pain and headaches and such. So trying to keep those shoulder blades down and back, again, to open up that chest wall and facilitate better posture. I tell my patients, from what I've learned from Jeff over the years, is to do it 100 times a day, and people look at you like you're crazy. But talking about wake up, sit on the edge of your bed, do 10 of those gentle squeezes, make breakfast, do 10 more, and do those throughout the day as you're sitting in your chair, at your workstation, whatever it is you're doing, just to keep awareness of that good posture. Next, we're going to move on to some exercises for the arms, strengthening exercises. So let's just start with a simple bicep curl. And you can do these both arms at the same time. You can alternate, do one at a time. We're doing it without resistance right now, but if that seems too easy for you after 10 or 15 repetitions and you feel like you need something more, you don't have to go out and buy yourself a set of weights and bands. There are plenty of things around your home that you can use for resistance in all of these exercises shown. One of the things that we like to tell patients is to simply grab a couple of water bottles, a can of soup, anything you have that feels like good resistance to you. Again, we don't want to cause pain. If you feel like you're being overstrained, take that resistance away and simply do the reps just against gravity.
And as you're doing this, again, keep a good posture, keep straight, keep your tummy tucked.
Shoulders back and down. And nice and controlled. And that's what I'm going to stress for all of these exercises, is that we want it nice and slow up and controlled down. We don't want snapping up and down. The more you control a muscle, the more it's working properly and we're gaining the strength that we're going for. The next one we're going to do is shoulder flexion. And we're just only going to go up to 90 degrees today and then back down. Again, you can do this with or without resistance, however you're comfortable. I tell people to 90 degrees or around there to avoid any shoulder impingement or pain issues. A lot of people have some shoulder instability, especially if there's poor posture involved. So again, watching your posture, but just going up to that 90 degrees is going to give you a good resistance, but not cause any shoulder pain or issues going further or higher than shoulder level. 10 or 15 reps, whatever you're comfortable with. Increase your reps by 2 or 3 every time you do it if you feel comfortable with that. The next one we'll do is out to the sides. Same idea, nice and slow and controlled to 90
Thumbs up.
degrees and keeping our thumbs up. The reason that we call it open can position, we want to make sure that we keep the liquid in our cup if we were holding a cup. And that is to open up the shoulder area. If you have your hands pointed down or thumbs pointed down, you don't have the movement within that shoulder joint, and you can very easily impinge and cause pain in the shoulder. So whenever lifting or doing these exercises, always make sure to keep your thumbs up. And holding a water bottle is a good reminder of that. We don't want to spill our water. Moving on, shoulder internal and external rotation. So keeping elbows at your side, you're simply just going to pull out and back in. We don't want to stress or strain. Again, external rotation in this direction is not a big motion, so don't try to push it. Always keep the elbows in for proper motion. You shouldn't be winging your arm all the way out. It's just a simple kind of a windshield. That's incorrect. A windshield wiper motion back and forth in that comfortable plane right at your sides. If you had any band at home, I know there's some people have bands laying around, just make sure that it's not too heavy of a resistance, and if you're straining while you're doing it, it's too heavy. So please get rid of the resistance if it's causing you to strain. But just as Jeff is performing, elbows stay to the side and doing that same motion, just holding the band across your midsection. If you are adding resistance and have not had the resistance before, and it's new to you, decrease your repetitions. Feel out how your body is responding to these exercises. If you're getting sore with the resistance, or it's too much for you, decrease those reps, decrease the resistance. We want it to be gentle and not causing any pain. We're gonna move on to some trunk rotation. Again, sitting in a chair, if you're doing office work or stuck at home and in your chair a lot, we tend to get really stiff through our midsection, our torso, and our trunk. And so this is just a simple exercise to get some motion through there, a nice stretch. And all you're gonna do, as Jeff is demonstrating, is just rotate right at your waist. Again, not pulling yourself into that rotation, just a nice gentle rotation back and forth. And do it 10 times per side. Throughout the day, same as your squeezes.
Just be patient and persistent.
Correct. Yep. And mindful. I've told patients, set an alarm if you need to. A lot of people forget to get up. They get into a good book or a good show or what they're doing, and they simply just forget to stand up or forget to move. So set your alarms and be moving every hour, half an hour even, just to keep that circulation and good movement throughout. Next, we are gonna do some sit to stands before we work the legs. So,
Sideways or facing?
up to you.
Stack this way.
That's fine. When you're going from a sit to stand, especially if you are in an elderly population, we want you to first try to move to the front of the chair so that you have your legs underneath you and you have good stance to be able to push up and use those muscles in your glutes and your legs to push you up out of the chair and not strain your lower back. Again, be aware of your posture while you're doing this. Jeff is not using his arms on the chair to assist standing up. However, if you are unable to control your sit to stands and you find yourself plopping when you're sitting down, we would encourage you to use your arms to push from where you're sitting. And again, reaching back towards your chair to help you slowly lower yourself into the chair as you're sitting. Doing this 10 times at a time. Just gets you up in that upright position. Watch your posture. It's good for glute strength, overall leg strength, and just gets circulation going. Next one we're going to do is a stretch, and this is kind of a double stretch. We're going to stretch your hamstrings on the back of your thigh as well as your gastroc or your calf muscle. You simply just
I have my slippers on.
they're very nice.
Can you see those slippers there, Morgan? Those are actually bananas, but I call them slippers.
So just extending your knee out in front of you and gently moving that ankle back and forth. You'll feel a stretch on the back of your knee as well as into the calf muscle. Again, we want it to be just a gentle stretch, nothing that causes pain or is straining. You could also prop your foot up on a stool, ottoman, footrest, whatever you have, if that's more comfortable than holding your leg up by itself, just to give some support under that leg while you do that. Moving on, just to some leg strengthening exercises. So what I'm going to have Jeff do next is some seated marches. And it's as simple as that. Just up and down, we're working hip flexors. You can alternate legs or do one at a time, however is most comfortable. If you want to add some resistance to this and you don't have any weights at home, do as Jeff is doing there. Just simply put your hand on your knee and just give a little self-resistance as you go up and down. The next one, we're going to do some knee extensions and kickouts. We call them long arc quads, and it's simply just extending the knee. A lot of people with knee pain may find this uncomfortable to do. If that is you and you have arthritic knees and it is uncomfortable, cut this one out, or you can extend your knee, rest your foot on the floor, and do a quad set. So we're just tightening that thigh muscle and relaxing it. Tighten and relax. And that's working the same muscle without straining that joint.
Or you could go a little bit less distance.
Shorten up that lever. Again, doing 10 to 15 reps on each side. The next one we have is heel slides, and this is to activate your hamstring muscle on the back of your thigh. Just pulling your heel back and bending your knee. You want to give some drag into the carpet as Jeff is doing for some resistance. If you don't want that much resistance, do it on a smooth floor with a stocking on. But the more resistance you want, the more you dig your heel in and pull and resist yourself. And you can also resist yourself with your opposite leg if you need a little bit more, or as you progress and you feel stronger doing it, add that resistance as you go. We're going to work on some hip muscles, so this is called abduction and adduction. And we can do it several ways. I'm going to have Jeff start out with just what we call an isometric, so self-resisted. He's going to place his hands on the sides of his knees, push out and hold for 3 to 5 seconds, and relax, and do that 10 to 15 times. You could also use a band if you have one available, and simply wrap it around your knees and pull out against that band. Again, I would still say to hold 3 to 5 seconds for nice control and to get that muscle activation. And that is hip abduction. The next one we'll go into is hip adduction, pulling those knees together. Jeff is demonstrating obviously with the band. You can do it one at a time. Another great option is to use a ball if you have one. Not everybody has 2 little boys running around their house like I do and have balls like this laying around. Another option that I have people use is just simply a bed pillow or a couch pillow or anything that you can roll up and put between your knees. That's a very fluffy pillow, yes. Put between your knees
But you don't want to chew on it.
and squeeze. Yes, like Jeff said, you don't want too much there. You don't want your hips you don't want to abduct your hips too far and cause hip pain. So a towel roll may be a better option too if that's a little thinner.
Couch pillow.
Couch pillow too, yeah. Again, holding 3 to 5 seconds to make sure we have that good muscle contraction. The last one that we were going to talk about is heel toe raises. Well, we could do seated and standing position, but in seated, keeping your feet flat, raise your toes off the ground and then your heels off the ground, going back and forth. This is recommended always in whatever your setting is. If you're at a desk, if you're in a recliner, on an airplane, which not a lot of us are right now, but in the future.
Very good for circulation.
Riding in a car, it's great for circulation. It pumps fluid and that blood flow through your lower extremities, your legs. And I mean, we tell patients of all ages, post-surgical, and just any patient, this is good to do throughout the day. You can do it laying in bed, sitting, reclined in a recliner, or if you stand up and you are supported by something stable, such as a countertop or a chair that's not moving, you can do it in standing as well. And that's just a little more progressed. You're gonna obviously have more resistance from your body weight in standing, but doing that throughout the day is another great option for strengthening and overall movement.
So you want to do those one more time? Just really quickly, just go through one at a time, and these are just good all-purpose exercises. So one more from the top.
We're gonna start with our stretches in
Okay.
the wrist, holding 20 to 30 seconds, going into shoulder rolls backwards, watching your posture, keeping your core nice and tight, into our shoulder blade squeezes, back and down. We never want the shoulder coming up towards the ear. 100 times a day. Again, if it's 8 o'clock at night and you've only done 10 for the day, don't try to knock out 90 because you're gonna be really mad at your therapist or yourself the next day.
Or Megan.
Throughout the day. Going into some bicep curls, nice and slow and controlled motion, alternating or together, whatever you tolerate. Add a can of soup or a water bottle if you would like more resistance. Into shoulder flexion, only to 90 degrees, thumbs up. Same with out to the side, 90 degrees, thumbs up. Do it to your comfort, 10 to 15 reps. Shoulder internal, external rotation, stay put. Add resistance if you are able or comfortable with it. Keep your elbows tight to your side. Trunk rotation, twisting from side to side, not pulling yourself or straining, just gentle rotation from the trunk. Sit to stands, focusing on nice controlled movement, no plopping. Use your arms if you need to control yourself. Next one is seated stretching. Prop your foot if that's more comfortable for you, but just extending that knee and pumping that ankle back and forth for a nice gentle stretch behind the knee and into the calf muscle. Seated marching, alternating or one at a time, 10 to 15 on each leg. Remember, nice controlled motion. Long arc quads or knee kickouts. Again, if this bothers your knee, you have arthritic knees, you can do that simple quad set where you just tighten that quad muscle and relax. Or as Jeff had mentioned, doing it in a smaller range of motion, however you're comfortable. Heel slides, bringing that heel back. If you don't want the resistance, do it on a smooth floor and stocking feet. If you want the resistance, drag that heel into some carpet or put your other leg behind it to give some resistance. Hip outs and ins, rolls out and in. Self-resisting, just pushing out against your hands and pushing in. And then the last one, the heel toe raises. So either lying down, seated, or standing. That's it.
So again, thank you for your time watching. If you have other suggestions for things that you would like us to do, please make a comment on it. Again, look at our YouTube channel. We do have virtual assessments available if you choose to do that way to keep you safe. Be safe, and for all the graduates out there, happy graduation.
Go NDSU, horns up.